So now let me first bring the films up here. I got them and I'm sharing them with you. Here it is. Are you able to see them? Are you able
Yes.
to see the films?
Dr. Bassi, you're going to have to talk louder or
I'm
towards
going
it or
to speak louder. You hear me better now?
a little better. Yes.
Okay. So I'm making the films bigger. Now, first of all, tell me, how are you doing? How is your pain?
I'm doing a lot better. It seems like the last 2 weeks or so that my pain is a lot less. It's, I can get around actually pretty well.
Now, 1 to
The-
10, how bad is your pain now?
in my what?
1 to 10, how bad is your pain right now?
On an average, I would say maybe 2 or 3.
2 or 3. How bad was it before the surgery? How bad was the
A
pain?
9 or a 10. It was
9
all
or
to the
10.
point where, yeah, where I couldn't function anymore.
How far could you walk before the surgery? How far?
Oh, I don't know. I actually really wasn't walking a lot because the pain was so severe.
Yeah. How far can you walk now?
How far do we usually walk? I don't know how much this is, 1/4 of a mile.
Yeah. 1/4 of a mile, that is a lot. That is good.
That's a lot, and I thought that's not near enough.
Now that is, walking a 1/4 of a mile. This is a good amount of walking. So now let me look at the films with you. This is the down view of your spine, and these are the top screws. They are in the perfect position. And I'm coming down, and the spacer, the first spacer is in very good position. Are you able to hear me? And look at the bone in the back on the left side in the what we call 2-3 facet is growing.
They were not understanding that.
The bones start to grow.
Oh, starting to grow. Oh,
Yeah,
good.
bone is actually growing very well. Look at that here, here, and here. The bone in the front is growing. The screws are pretty good position. They're not pulling out. They're doing anything they're not supposed to do. They're doing very well.
Now, have they moved at all since you
No.
positioned them?
No,
No,
they're good. They're good.
they're good. Okay.
Yeah. And bone is growing really well, even though it has been only 4 months. The bone is growing beautifully. And spacers are good.
I'm using the bone stimulator, you know.
Good, and that's healthy.
Yes.
And then I'm coming down. It look very good. All the bone are growing, even it has been only 4 months. After open old-fashioned surgery, I expect a picture like that a year after the surgery. Now we are 4 months and the bone is already growing. So I'm very happy.
So am I.
Excellent. Now, overall, your daily activity has been all right. Are you getting along in your daily activity? Are you doing all right?
Yes, I know my limits by now, what I can do and what I can't do, and when I need to quit and so forth. Yeah, I've learned that.
Okay, and I'm looking at the data of the surgery, and yeah, the surgery was about 4 months ago, and we did the surgery only in 73 minutes, and it lost about 2 ounces of blood, really nothing. So I'm very happy with the results so far, and I think you're still going to get better. But for 4 months, I think you're in a very good place. So I'm sure you may have some question. What question do you have for me?
Okay, like when I go for my walk, I have, I talked to you about it before. I have the rubbing. It feels like rubbing of my bones together in the back. Is that normal for now, or will that get better?
It will get better. It's normal for now, and it will get better, feel better.
Okay, another. The L4, I was reading through the report and it says that the 1L is narrowing. Is that right above where we did the surgery?
There is lots of, your spine does not look like a 20 or 30 or 40-year-old spine. So there are lots of changes, but I'm looking at everything. I'm okay with everything I see, as well as if your pain is 2 or 3, as you just told me. I wouldn't be worried about all the subtleties of what the radiologist reads there. I think what matters is how you feel. And what I'm looking at, I'm okay with everything I see. Certainly, there are some changes all around your spine, but none of that is something I'm surprised about or I'm concerned about.
What is it?
I'm not concerned about the L4. I'm okay with that.
Okay, how about the L1?
And as well, there are some changes in the L1 too, right here. There are some changes. This is how old are you?
63.
Yeah. This is how old you are?
83, sorry.
No.
You must be paying attention because you caught it.
And so is your spine. Your spine is as well 83 years old. So it looked like an 83-year-old spine. But for an 83-year-old spine, I'm not concerned neither about L1, 2, or L5, S1. But good one. That was a good one.
Good one. Okay. How about bending over and picking things off the floor?
I still prefer you not to do too much bending and twisting. It's not going to be good for you.
That's not good for me.
No.
How long
but
will?
Let me tell you, it is not good for your husband either to bend and twist.
Oh.
It is a general thing. At your age, bending and twisting are not going to be a good motion that you should keep doing.
Okay. All right, that's pretty hard to do.
No, actually, I'm going to send you to physical therapy. They show you how you can live a good life without bending and twisting. It is possible.
It is possible.
Yes, it is.
I think I'll have to take my reacher and attach it to my body.
For example, but that's just one trick. There are way more tricks that the physical or occupational therapy can teach you how to have a full and good life without too much bending and twisting.
Do you recommend bowling?
Bowling?
Yes.
Well, I don't believe I have ever been asked that before. Well, you have to have fun. So do a little of it and watch yourself. Be careful though.
What do you say? But be careful. Okay. We bowl on a bowling team. We don't have it this year because of COVID, but I enjoy it so much.
Well, by the time COVID is done and you can go back bowling, I think you'll be all right. Now, where do you live? Where do you live, Mrs. Where do you live?
We right now we're in Arizona, but our home is in Jamestown, North Dakota.
North Dakota. Okay. Well, by the time summer comes and everything goes back normal, I think you will be more than fine. Your spine is already healing now, and it's going to be even better. So I like to see you in 6 months with another CT and go from there.
Okay, and I'll do that in North Dakota then, and
good.
And we can come to Alexandria.
Sounds good. I have a favor of asking. May I use this conversation, this consultation and use it for educational purpose and publish it on internet so other people can learn? Because you ask questions that are very typical for other patients as well as I want to show people your spine that in 4 months already growing, even with your age. Only if you're okay with that, I would like to use this video for educational purpose and on internet.
If you can use my
your conversation to teach his students.
You sure can, Dr. Abbasi, but I attribute a lot of it to the information you gave me about the bone stimulator and so forth.
Thank you.
And the back brace that I wear, you know, when you traveling,
Yeah,
I think that has been good.
yeah, your experience, I'm sure other people in your age group would appreciate your information to what expect. Now, overall, did you have leg pain before the surgery?
Yes, I had shooting pain down both legs.
How is that leg pain right now, or generally now?
I don't have any.
When did that leg pain go away?
Right after surgery.
Excellent. And I know you stayed in the hospital a little longer than most of my patients. You stayed there for how many days?
I think 4 or 5 days I was in the hospital, then I was in rehab for 10 days
Yeah. Well,
in a nursing facility.
yeah, and and that is a little usually longer than most of my patients, but it's nothing unusual. When you get older, just the recovery from the anesthesia is just a little more. But I understand that you walked right away after the surgery, and the pain in the leg went away right after the surgery.
Yes.
These are all good things. These are for a big surgery you got with only 2 ounces of blood loss. This has been a quite successful kind of surgery.
Well, I thank you for that so much.
You're very welcome, and I really appreciate your input. And if you have any questions for me, I can answer it now. Otherwise, somebody from my office will call you, and we will meet in about 6 months. I send you to get some physical therapy to teach you how to live your life fully without bending and twisting, and as well ask them about bowling, and maybe they have some tricks that you can do bowling uh, in a way that is more gentle to your spine. Okay.
Okay. How long should I continue with physical therapy?
I would say just somewhere between 4 and 6 sessions for educational purpose.
Could you repeat that?
There's 4 or 6 sessions.
4 to 6 sessions.
Okay, we'll do it.
Okay. You have a great day now. Okay.
You too.
Bye-bye.
How's your weather in Minnesota? Is it cold?
It is. You're in the right place. You don't want to be right now in Minnesota. So enjoy Arizona.
All right.
Okay. Bye-bye.
Bye. Still on, huh?